Singh Kahlon. So today we are going to discuss about the latest update about the coronavirus. So you guys know the numbers are increasing, the cases are increasing because this is the pandemic. So we don't have to worry about the numbers. So I'm going to give you here small data about the countries and about the cases that increased already. So almost 6,650 cases is confirmed of a coronavirus and 30,000 is a death, and USA is on the highest number rate. So almost in USA right now 1,23,000 cases is confirmed, and in Italy 92,000 cases are confirmed. Okay, so these were the small data. These are the highest, like right now the cases are going on in USA, Italy, then China, then Spain, and then Germany. If we are looking to the India data, so in India almost and that 25 deaths are confirmed. So if we compare with the Ukraine, so in Ukraine almost 480 cases are confirmed till up to date. Okay, so we are not here to looking the numbers because this is pandemic, the number will increase, so don't worry about the numbers. So today our main point is that we are going to discuss, that is the advisory for Indian community and for the Indian students in Ukraine that right now are studying. So according to this advisory list, Ukraine will be locked down till April 24. Okay, and in this all the passenger services from the Ukraine is suspended till April 24, 2020. So same in India, the lockdown till for the 21 days from the 25 March onwards 14th April 2020. So till that time no flight, no one can travel from Ukraine to India, from India to Ukraine. So कोई भी इस time travel नहीं कर सकता. So guys, it is not possible that anyone can travel from Ukraine to India or India to Ukraine. Okay, so these were the highlighted points that in the advisory list that is given by embassy, and definitely so this is the advisory list. So guys, you can check the current updates, and there's the emergency number is given, so you can call on this number unless you don't have any emergency. Okay, so our Indian embassy is a regular in touch with the Ministry of Health Affairs, with the universities. Okay, so they have assured that the same type of treatments our students are going to get it if they are get infected, same like a Ukrainian citizen. So don't worry about the treatments. Okay, so Ministry of Health Affairs of Ukraine is assured that they are going to give the same treatment. So guys, this is the situation, is not for the panic. Same I request to the parents, same I request to the students, stay isolated, make a social distancing. Okay, you don't have to worry about the numberings, what is the numbering going on. Numbers definitely is going to increase because this is a pandemic. The coming 10-15 days or maybe till 20 days the number will be keep increasing. All you have to do, stay isolated and stay social distancing, make social distancing. Okay, as I discussed in my last video, the incubation period of this around 0 to 24 or median if we are taking 0 to 14 days. Okay, so in this period, so इस period में जो लोग infected होंगे, they will come outside or they will be isolated. Okay, so 80% लोगों को mild symptoms ही आएंगे, they will be recovered, they don't need any type of hospitalization. So if we are talking about how this virus spreads, so in last video I talk about the droplets. So here even the recent studies are saying that this droplet virus, when we coughing or sneezing, okay, or we call this respiratory droplet. Okay, this have potentials that is going to affect from 3 to 6 feet. Okay, and if this respiratory droplet is on the surface, that have potential to stay around 24 hours. Like if someone is a touch of that droplets or your mucus, that person can get infected. And the second spreading that can spread, that the fecal oral. Okay, if anyone get infected, okay, they didn't fecal, they didn't wash properly hands or then bottoms, okay, and they touch the toilet here there, and the other person will become and going to touch that surface, is also going to affect the persons. Okay, and the third, this even virus have potential to stay in the air. Like for example, if someone is a cough or sneeze, this virus is going to stay around minimum 3 to 4 hours in the air. If someone is a walk, go around that can be get infected. Okay, so guys, to make sure you have to do the good practice washing hands, stay isolated. So guys, now don't think about the traveling. This is my personal opinion, being a doctor, and you are going to become a doctor, so you have to understand one thing: you are young, you can recover, because when you are going to travel, you are going to in touch with आप काफ़ी लोगों के टच में आएंगे. Okay, and because you are going to travel from airport to your home, and same thing, everything is lockdown, and even for the parents, this is the biggest task to take you from airport to at home, and they are going to get infected. खुदा ना खास्ता उनको कुछ हो जाता है, तो who will be the responsible? You are young, you will recover, but your parents are going to face the same problem and situations, that the condition will get the worse. Okay, so I advise you guys, wherever you are staying, okay, आपने घरों में ही रहना है, stay isolated, अपना प्रॉपर सफाई का ध्यान रखो. बाहर भी अगर आपने जाना है, ये नहीं कि आपने यही खाना है आज. Whatever you are getting, okay, make it, cook it and eat, and stay isolated and make social distancing. So I request to the parents and the children and the students that are studying in Ukraine, this is the time to don't get panic. This is the time to stay calm and be strong emotionally. Okay, and so guys, this is the time for the support to each others. Okay, and think about, be positive. Okay, forget about the numbering, whatever is coming. You guys have lot of material for the study. You know, your online classes आपकी चल रही हैं. Okay, आप उस पर ध्यान दीजिए, and whatever the topic you missed in the last time, so try to cover that. Okay, this is the time that you can study, you can work on you. So guys, stay calm, be patient. And the last thing I want to discuss about the treatment, you know, the recent treatment is going on, hydroxychloroquine. Okay, this is the antiparasitic that we use, this drugs we use in malaria. It means not that you have to take this medicine. So this medicines वही ले सकता है जिसकी history from the infected countries, or if someone have a travel history, or they are present with the mild symptoms. So we use this drugs as a prophylaxis, hydroxychloroquine, for these type of patients. Okay, so it means not that you have to go and get, and who are the needy people जिनको इसकी सही में ज़रूरत है, उनको ये नहीं मिलेगी, and you are going to use this tablets. I have seen on the WhatsApp, on the Google, that hydroxychloroquine person can use as a prophylaxis. Okay, and you don't have to rush for the medicine and take this medicine. Okay, till that time, any registered doctors or registered physicians, or you're not getting any recommendation from the hospitals, only then you can take this medicine. Okay, other medicines are right now going oseltamivir, lopinavir. Some doctors and some hospitals are using combination of this medicine to treat the SARS pneumonia. So guys, stay isolated. This is the best treatment and the best vaccine. Okay, isolation. Even 2 to 3% people are dying. 80% have a mild symptoms. 15% are going to swear. Agar 2 to 3% patient, if someone is get infected in your family or you, that is going to affect you 100%. So guys, keep in mind, whenever you go outside, whenever you coming inside, wash your hand properly first. Go in the washroom, and जो भी आपके कपड़े जो आप पहन के बाहर गए हो, put in the washing machine, wash it. Whatever you take from the outside, even it's your packet of a chips, even it's your milk packet, अगर आपके जो है दूध का पैकेट है, चिप्स का पैकेट है, whatever you taking outside, come wash it, then use it. Okay, so guys, keep in mind. हाँ, मैंने अभी एक वीडियो देखी थी जिसमें कह रहे थे कि बार बार मिलना है तो घर में रहो, नहीं तो आप हरिद्वार में मिलोगे. So guys, keep in mind, stay calm, stay relaxed, stay isolated. Thanks for watching. Have a good day, stay calm, and make a social distancing. Thank you. Thanks for watching video.
Don't forget to subscribe to get latest update for study MBBS abroad, and bell icon for notifications. Thank you and have a nice day.